All right, so we'll talk about the iliopsoas. So that's a combination of two different muscles. All right. So the iliacus is going to come off of the iliac crest here. So it's going to come off of this surface here, and then it's going to go across the hip. And those are all, the iliopsoas is going to insert onto this lesser trochanter right here. So when it pulls on this portion here, it's going to flex the hip. It's also going to externally rotate, because that lesser trochanter is right there, so it's going to do this motion. Now, I tried to load some of those videos like I had before on here, but I don't know. I used a different format. I'm not sure if they're going to work today, but we'll see. And then, so the iliopsoas, the iliacus is going to come off of the ilium here, and then it's going to insert onto the lesser trochanter. It's going to flex the hip and externally rotate it.
Can you explain why that's externally rotating? Is that the hip
We're
joint?
talking about at the hip joint, yeah. What you do is when you talk about internal and external rotation, that's a good question, is that you're referencing it from the anterior part of the thigh. So when I do this, the anterior part of my thigh is going external. Okay? So this is external rotation. Don't look down here, you get confused. This, the anterior part of the thigh is going which way? External. The anterior part of the thigh is going which way? Internal. So if I do it without bending the knee, I go, if you look at the foot, then you're okay. It's external rotation, internal rotation. But you always want to reference it to the anterior part of the thigh.
Is it external versus lateral? Can you say lateral?
External is lateral. You could say lateral rotation or external rotation, internal or medial rotation. Same thing with the shoulder. Internal or medial rotation, external or lateral rotation. All right, so here let's see if this works. I don't know if it's going to work. I think it's what it's going to sort of play in a jerky type fashion. So there they're pointing out the area where the iliacus originates from, and then where the psoas comes from the upper lumbar vertebra. So then, yeah, there's the psoas. That's the iliacus coming more off of the top of the iliac crest. And then they both come down to that common tendon on the lesser trochanter. So there's the lesser trochanter where it inserts onto. And then he's going to show you the motion of it. So in the standing position, that's the motion, but in this position, when the legs are flexed, it's going to flex the torso. Okay? So it comes into play, it's important when you're doing sit-ups. Okay? If your psoas attaches to the front part of your back, right? Attaches to the lumbar vertebra. So when you pull on the psoas, what's that doing to the lordosis in the low back? Is it increasing it or decreasing it? If it pulls on the front, it's going to do this, right? It's going to increase the lordosis. So if you're doing sit-ups and you're coming all the way up, or if you're anchoring your feet underneath, because like I said, if you anchor the thigh, and you flex at the torso, then you're using your psoas, and it's doing it in a way where it's going to increase your lordosis. So you're better off, if you want to do abdominal muscles and you want to work the abs, don't hook your feet underneath. and don't come very far up. You just do what they call it crunches, right? So that's going to work more of your abdominal muscles versus bringing your psoas into play. Okay? So that's why it's important to understand that, you know, the motion of the psoas is to flex the hip, but what if the thigh is fixed? Then it's going to flex the torso, and when it does it, it increases the lordosis. So it's pulling on the front of the vertebra, so it's going to increase the lordosis. So it's more likely to give you back problems if you're doing them that way versus if you're doing crunches. Okay? And then the other thing is, I don't mean to offend anybody if you're vegetarian or anything like that, but like on a cow, for example, when you talk about the psoas, I mean, that muscle doesn't get moved very much, so it's not very tough, so that's basically the tenderloin. When you're talking about cuts of meat. All right, so now,
I think you bumped your table.
what's that?
I think you bumped your table.
And we're mainly concerned about the psoas major.
Yeah. Psoas minor is like a little smaller muscle that sits on the surface of it, and then the iliacus goes along with it. You know, we didn't even mention, but there is a psoas minor.
What does
It's
that do?
almost like a small muscle with a tendon that goes along the psoas. And then it's usually put together with the iliopsoas.
Okay.
But a lot of times when you talk about the psoas, because you're talking about, that's the one that goes to the spine, to the vertebra, whereas the other one's just going across from the ilium. But you should be aware there's two different parts. All right, so now you have the tensor fascia lata. So by the name of it, remember you have this fascia lata, which is the fascia that goes around the whole thigh. And then there's a thickening of it called the iliotibial band. Okay? So on the front of that, you have the tensor fascia lata. So that's going to be this muscle right here. Okay? And you can feel that muscle. So I think it's better if you're standing, but if you feel right here, like basically where you go into where your pocket is, and if you turn the leg in, you feel that muscle belly working. Okay? I don't know if it works when you're sitting.
Not really.
Not so much. It feels better when you're standing. Or if you even just put your leg out like that. So it's going to be right here. Basically like right where you put your hand into your pocket. So it's this muscle belly. Like if you bring the leg up, it's that muscle belly that pops up right there. And we're going to do some palpation stuff later, so we'll go through and find all these different muscles and stuff. Okay? So it's going to come off of the ASIS and then the anterior part of the iliac crest. So here and a little bit up here. Let's see if I move this a little bit better. So it's going to come off the ASIS and a little bit around the side here. It's coming this way. It's going in towards the iliotibial band like this. And then what it attaches to is it doesn't attach to bone, it attaches to that iliotibial band or iliotibial tract. Okay? So that's going to be this right here. So again, the glute max inserts onto the back side of it, and the TFL attaches to the front side of it. So it's going to do flexion of the thigh and abduction of the thigh. And then also a little bit of medial rotation. Okay. And let's see if this cooperates. Basically, I think it's going to turn around. It's showing that you can see that this is fascia that's contiguous all the way around the thigh. So it's a complete sheath that goes around the thigh, but there's a thickening of it on the lateral side. Because your pelvis needs to be stabilized from lateral motion like this. Okay? There's going to be some abductor muscles up here, glute medius and minimus, that are going to help with stabilization of it.